Hi there, welcome to Your Voice with Senator Ball. I'm your host, Brittany Oate. You know, there's a big battle going on right now in New York between big insurance companies and the people who purchase premium insurance plans only to find out that they are stiffed with the bill in their time of need. And one of those people is joining me today. Her name is Maureen Kenney, and her husband unfortunately was faced with a $99,000 medical bill after he was rushed to the emergency room. And she is now stuck with this bill and trying to deal with that. We're going to talk to her about that. We're also joined with Senator Ball. He is working on legislation as we speak to try and make sure that people do not have to deal with this problem any longer. Thank you both for joining me.
Pleasure to be here. Thanks for being here, Maureen.
So, Maureen, I want to start with your story. How is this affecting the hard-working people of New York like yourself? What does this do to you?
Well, imagine my surprise when I opened up an invoice to find that I was liable for $99,000. It's been an interesting journey working through this with the insurance provider and many different people in the hospitals and billing offices. The amount of time and productivity that has gone into my particular claim is just astronomical. What I have found is that a lot of people, neighbors of mine, friends, have dealt with similar issues, but not to the shock value of the $99,000, and they've just gone ahead and have paid those bills without fighting them, because it is very difficult to work through these claims with the insurance companies.
And Senator Ball, when you hear $99,000, what goes through your head?
It's a 99999 plan that we sure as hell can't afford. And it's the, I may have gotten 1 9 off, but this is the point. I mean, you have, once again, multi-billion-dollar insurance companies that are seeing record profits, not only in the United States of America, but in New York. You have a healthcare system that is absolutely broken. You have doctors that are being forced out of the state in droves, especially specialists. It's actually reaching critical proportions. A lot of people think that, you know, doctors, all they do is drive Lamborghinis and golf and make a boatload of money, but really, because the system is so broken, we are hemorrhaging doctors right and left out of the state. And meanwhile, blue-collar families are being held over the barrel by insurance companies that are seeing multi-billion-dollar profits. And what Maureen just said about the fact that they do hide behind the loopholes that have been created and hide behind the curtains that have been created, allowing them to suggest that they provide more comprehensive coverage than they do. And then when you know what hits the fan, they come back and say, oh, you're out of network. And for some families that get a $500 bill or a $3,000 bill, or maybe even, you know, $5,000 or $10,000 bill, they find a way to pay that. Now that, meanwhile, goes right into the coffers of these large insurance companies. Right. But then there are families, and we're not only seeing it with Maureen, but we're seeing it with families throughout the Hudson Valley, that are absolutely devastated, and the insurance companies are hiding behind it. I think it would be interesting, Maureen, could just go into the specifics of you know, how this came about, and that, you know, some people may be watching like, hey, you signed a contract, it was out of network, and tough on you. So if you can explain the kind of the nefarious angle of the insurance companies.
Sure. First of all, I want to say that the care that my husband received was second to none. The doctors, the facility, they all did an excellent job caring for my husband, and they do deserve to be compensated for the services that they provided. My husband as well, thank God, right now. What had happened with us is that he had a heart condition. He was taken to the emergency room at a local hospital, which happened to be in network. They attempted to treat my husband at that time.
What year was that, Maureen?
This was 2011, April, yes. So they attempted to treat him. They found that the treatments that they were giving him to stop an erratic heartbeat was not successful. They did not have the ability at that hospital to treat him and to perform the necessary procedure that he needed. So they arranged transport to another hospital nearby that was able to do that procedure for him, which happens to be a regional trauma hospital as
Okay.
well. So we were feeling very secure in the decision to transport him so he could have the procedure done. He had the procedure done at the second hospital, which happened to be out of network. Never during the entire episode were we told, nor would we be expected to be told, that the second hospital would be an out-of-network hospital. We didn't realize this until the bill came afterwards.
So you had no idea when he was being treated, when you were at the hospital, even after you took him home, that this was an out-of-network
No,
hospital?
it's not something that you think about when you're going through a very serious event, health event such as that. You're focused on getting the care that you need and just following through the way that the trained physicians are telling you that you should follow through, and that's exactly what we did. We don't expect the doctors to say, "Oh, well, stop. You know, we're not going to recommend that you go there because it's an out-of-network hospital." Right. They're telling you you need the care here because this is where they can perform the service that you need.
And I think, you know, for people that are watching that, and I know we don't want to get too much into the details because it's still ongoing to make sure the situation's rectified, but if you had this type of coverage, the assumption is very clear that you would be properly covered, and especially this is an instance where we're talking about life-sustaining medical care that was needed, and at the direction, you know, the proper direction. Any logical person would have thought that this insurance company would have not had the legal responsibility and the moral responsibility to make sure that this coverage was complete. And it's not the case. And this is not a limited instance. And, you know, to Maureen's point, with the physicians and the hospital being properly reimbursed, as these insurance companies rake in record profits, what taxpayers and folks need to realize is that the doctors are not, because of these insurance companies, they're not being properly reimbursed. The community hospitals are not being properly reimbursed. And we've seen time and time again community hospitals having to shut their doors and doctors leaving the state in droves, and especially those that are specialists that have the skill sets that we critically need in this state. So at a time when we should be attracting more specialists to our community hospitals, at a time when we see other states actually using the healthcare sector as a job creator, we're going in the exact opposite direction. And it's at a critical point now where that safety net is no longer provided to families that have the coverage that should provide them those services.
Absolutely. And New York's known for being a great place for health care. You can get top care, top doctors here. Are you genuinely concerned that we're going to see a flood of doctors leaving? I mean, there's other states that reimburse up to 80%. So if doctors leave, what do we do?
Well, I mean, the legislation that we have pending now to try to clarify some of this and get rid of the curtain that the insurance companies are hiding behind and hold them accountable is absolutely critical. And I can tell you that in speaking to specialists throughout the Hudson Valley, out on Long Island, and in New York State, they feel that if we continue to create an inhospitable and a hostile environment, that they're going to be forced out of state. And they say that. And in talking to the heads of hospitals throughout my district and beyond, it is a very tough state to attract new talent into the region because of the environment that has been created. And look, in politics, you can always follow the money. Absolute power corrupts absolutely, and the insurance companies are a multi-billion-dollar industry, and they have extreme power. They have a very strong lobby, and they need to be held accountable. And getting this bill done, I see it from a public consumer and a public protection standpoint to protect families like Maureen and her family throughout New York State, but I also see it as a job creation initiative to pull in more specialists, to retain our doctors, and to help save our community hospitals.
Absolutely. I know there's also a component of the health insurance companies being transparent in this bill. I want to go back to you, Maureen. When you purchased this health insurance, was there a clear understanding of what your benefits were going to be if you were to go out of network or to be in network? Did they make that clear to you?
There is a spreadsheet that does describe what your out-of-network expenses will be, but it's not clear when it's broken down how much that will actually pan out to be. For example, my out-of-network coverage is 80%. So you hear 80% and you think, well, that's not so bad. Seems fair to me. But what you don't realize is that it's 80% of what the insurance company thinks is a reasonable amount of money. So someone that might have a $2,000 bill will still be liable for up to $1,500.
Right. And then when you get into the kind of procedures that your husband had, that's not $2,000 anymore.
No,
You're
it's
talking
not.
$100,000.
Exactly.
So what has been going on for you since then? I know that you've been working hard, to fight the insurance company to get them to cover. What's the update?
Well, the update is that we're whittling away slowly and painfully. I was actually trying to get an update just this morning on exactly where we stand so I could have some firm numbers for you, but nobody was, after being on the phone for about 45 minutes with them, nobody was able to tell me exactly what was going on. At this time, I have filed a level 1 grievance, which has been denied by the insurance company. They have decided to pay the out-of-network fees of 80% of what they deem is allowable, and I'm still liable for about $60,000.
Wow.
So that's $60,000 that I am looking, if I'm continuing to fight the battle, but if I can't, I will be expected to pay $60,000. Wow. And I have a health care insurance policy. So at this time, I've filed a level 2 grievance, and I'm waiting to hear how that will be decided.
And when everybody talks about healthcare reform in this country, these are the type of horror stories that need to be avoided.
Right.
And replacing some pencil neck bureaucrat in the insurance industry with some pencil neck bureaucrat in government is not the answer. These are the things that need to be fixed, and we have the capability to hold these insurance companies responsible to do the right thing. And there's another example. It's a slightly different issue, but we had a young little girl in Yorktown Heights. Her name was Hannah Devane, and Hannah has eosinophilic disease, which basically her body rejects any food as a pathogen, and all sorts of horrible stuff when her body reacts to that. So she, imagine being a little girl, being at a birthday party, not being able to have ice cream or cake or anything like that. And the insurance companies, so she required life-sustaining formula, which costs the family over $2,000 per month. It's a blue-collar family living in Yorktown. Father's a cop. Mother was a nurse at that time. So huge financial burden on that family. And that insurance company actually, the bureaucracy went back and forth and wanted to demand that the child get a feeding tube placed before they would actually pay for that formula. Now, it didn't require that, but that's what that bureaucrat wanted to trigger some reimbursement for that formula. So I've seen this again and again, certainly as issues have come to my office. This stuff has got to be fixed. And I know the insurance lobby is extremely powerful. This has been will be a tough push to get through the Senate. I believe that we're going to be able to get this done. It has passed in the Assembly, and but we have to continue pushing specifically in New York to rein in the insurance companies.
And tomorrow you're actually going to be discussing this issue before the insurance committee, is that correct?
Yep, hopefully. That's the goal. Up in Albany, you never bet on anything. That's Saratoga. But no, seriously, this has been a heavy lift and a very tough fight. And we've been pushing this for months now, but I believe tomorrow that we'll see it get out of committee, get it through finance, get it on the floor for a vote, and hopefully that will be within the next few weeks.
That's great. That's great. And do you feel like you have good support in talking with your colleagues here?
Yeah, absolutely. It depends, who you're talking to. Albany is a tough, a tough labyrinth to get through. But the squeaky, whatever it is, wheel gets whatever.
The oil.
Yeah, there you go. And I'm a very squeaky wheel when it comes to things I care about.
Wonderful. So, in the last few seconds that we have, should we urge people then to contact their senators out there and let them know that this is important and that this is something that they need to get passed?
Absolutely. Call your senator, assemblyman, tell them Bill 5068.
Wonderful. We'll see you next time on Your Voice with Senator Ball. Have a great day.